Good afternoon, everybody.
Good afternoon.
I welcome you all to the 2025, another 2025 NMA Internal Medicine program. And this afternoon, as we always do as a matter of tradition, we have the president of the American College of Physicians. So this is something we like to do every year because it is important. We know we are all in the weeds together. We take care of the same patients. Our organizations share the same vision. So it is important that the American College of Physicians do understand the NMA vision, and they do come every year. So we appreciate that collaboration, and we're happy to continue that. Today we welcome Dr. Jason Goldman, MD, MACP, and he is, I don't think there's anyone better that could have come this year from the ACIP because of the times we're in. We'll get to that. Dr. Goldman is the president of the American College of Physicians. He completed med school at the University of Miami and internal medicine residency at Jackson Memorial Hospital in Miami, Florida. He has managed his private practice since 2002. He's a clinical affiliate professor of general internal medicine in the Department of Medicine at Florida Atlantic University. Before managing his practice, Dr. Goldman worked primarily in hospital medicine as an attendant at Mount Sinai Medical Center in Miami and Jackson Memorial Hospital in Miami. Dr. Goldman is a fellow of the American College of Physicians. In addition to being a fellow, Dr. Goldman was governor of the ACP's Florida chapter from 2016 to 2020. He also served as chair of the ACP's Medical Practice Quality Committee and is on ACP's Immunization Committee. He's actively involved with the CDC as the ACP's liaison to the Advisory Committee on Immunization Practices, ACIP, which I don't know if anyone Googled that. Yeah, you can Google it right now, ACIP. And serves on several vaccine work groups, including pneumonia and COVID-19. Dr. Goldman has authored several published case reports and policy papers and has received numerous honors and awards, including the ACP Richard Neubauer National Advocate for Internal Medicine in 2018, Florida Chapter Internist of the Year in 2013, and the Laureate Award in 2022. So I want you guys to give a round to Dr. Goldman as he walks up stage.
Thank you so much. Well, thank you so much. What an honor and privilege it is for me to be here to speak among so many well-respected colleagues. Dr. Edwards, Dr. Kane, thank you all for having me here. I want to talk today and take this opportunity. I'm privileged to join you today at the National Medical Association meeting, and I'm honored to be here on behalf of the American College of Physicians, representing more than 160,000 internal medicine specialists across over 145 countries. It is my privilege to speak with you as both a colleague and a committed advocate for the health of our patients and the integrity of our profession. Today, I speak not from a place of abstraction or theory, but with urgency, about an issue that strikes at the very core of our shared mission as physicians: the growing assault on science, the dismantling of our public health infrastructure, and the deliberate erosion of trust in vaccination, one of the most powerful tools in the history of medicine. Vaccination is, without question, one of the greatest public health achievements ever realized. It has saved millions of lives, prevented the spread of devastating infectious diseases, and fundamentally changed the course of history and the trajectory of human history. And yet, this triumph in science has become one of the most politicized and misunderstood and misrepresented interventions of our time. As a lifelong vaccine advocate, I have had the privilege of serving for over almost a decade as the American College of Physicians liaison to the Advisory Committee on Immunization Practices, or ACIP. In that capacity, I participated in CDC meetings, contributed to multiple vaccine work groups, and worked diligently to help shape vaccine policy and make sure that the voice of internal medicine was meaningfully represented in national vaccine policy. That the ACIP, I'm sorry, my computer is acting up on me. The ACIP was established in 1964 as a model of scientific integrity and transparency. Its members are carefully vetted and divested of conflicts. The decision-making process is rooted in evidence, health equity, and an unwavering commitment to public health. For decades, it was respected by scientists, physicians, policymakers, and the public alike. That trust, however, was gravely shaken on June 9, 2025, when Secretary of Health and Human Services Robert F. Kennedy Jr. removed all 17 members of the ACIP and replaced them with individuals whose backgrounds, objectivity, and scientific grounding are deeply questionable. Let us be clear, this was not a benign restructuring. It was a deliberate and dangerous attempt to transform a historically neutral scientific advisory body into a vehicle for anti-vaccine ideology. The implications are profound. Recommendations made by ACIP determined which vaccines are covered under the Affordable Care Act and by the Vaccine for Children program, which serves millions of low-income children. Undermining ACIP jeopardizes those coverages and with them the lives of countless patients. I attended the first meeting of this newly appointed committee. It was immediately apparent that we were no longer participating in a forum of scientific discourse. We were witnessing in real time the politicization of public health. From the outset, the new committee chair advanced the false assertions that natural COVID infection confers better protection than vaccination, a claim repeatedly disproven by rigorous peer-reviewed research. This wasn't an open debate. It was a rewriting of scientific consensus in service of a predetermined agenda. Soon after, a newly appointed committee member with a background in operations management from MIT posed questions that fundamentally distorted scientific data to suggest that monoclonal antibodies cause death. The discourse was not grounded in clinical evidence or public health data, and it recklessly undermined a treatment that has saved lives, particularly among high-risk patients. Then came a deeply troubling moment, a return to a long-debunked theory on thimerosal, with a presentation from an individual without scientific background. Lynn Redwood, a nurse practitioner, without the credentials or research, made a presentation that misquoted data, relied on discredited sources, and advocated for the removal of all thimerosal-containing flu vaccines, despite the fact that nearly all vaccines today are distributed in single-dose syringes that do not contain thimerosal. What her proposal failed to acknowledge, and what the committee refused to even deliberate on, was the practical implication of such a recommendation. Multi-dose vials are still used in rural, underserved, and lower-income communities where cold storage and cost remain significant barriers. Eliminating them without scientific justification would disproportionately harm the very patients that rely on them the most. Most disturbing of all, the committee voted immediately, without input from expert stakeholders, without peer review, and without appropriate analysis. The result was predetermined. The ACIP, as we knew it, had become a platform for fear, misinformation, and anti-science rhetoric. We have reached a critical tipping point. The American College of Physicians has taken decisive action. We have issued public statements, engaged with the media, sent letters to Congress demanding investigation and accountability, and joined a multi-stakeholder lawsuit challenging the unlawful dismissal of the committee and the systematic erosion of public health protections. But this is not a battle the college can fight alone. This is a moment that calls upon each of us, not just as physicians, but as guardians of truth and advocates for equity, to speak out. Science must be defended. Our patients must be educated. Misinformation must be corrected, whether it appears in the clinic, the media, or at the ballot box. As internal medicine specialists, we are uniquely positioned to lead this effort. Our training places us at the crossroads of prevention, evidence, and chronic disease management. We form enduring relationships with patients, families, and communities. And that continuity allows us to be more than just clinicians. We are trusted voices, public servants, and stewards of scientific integrity. The American College of Physicians is unwavering in its commitment to health equity and improved outcomes for all patients. In this, our goals are profoundly aligned with those of the National Medical Association. Together, our organizations have long worked to ensure that policy decisions reflect the values of justice, access, and compassion. And together, we must ensure that science-based recommendations remain transparent, inclusive, and free from political distortion. The responsibilities of advocacy must be extended well beyond the clinic walls. The same intellectual rigor that guides our diagnostic reasoning must inform how we engage the broader world, whether through support for public health funding, the expansion of Medicaid, investment in a more diverse and culturally competent workforce, or the defense of ethical, evidence-based decision-making. In the absence of any physician leadership, others will fill the void. Individuals untethered from data, unburdened by clinical experience, and unconcerned with equity. If we abdicate our role, we risk ceding the future of healthcare to voices that do not speak for patients. Now is the time to reclaim the narrative, to remind this nation that science is not partisan, that truth is not a matter of opinion, and that the physician's calling is not for political gain, but to the well-being, dignity, and future of those we serve. In this moment, science cannot be mistaken for neutrality. It is complicity. And the cost of that complicity is borne not by institutions, but by patients, especially those most vulnerable, most marginalized, and most often unheard. The charge before us is clear: to speak truth with consistency, to act with compassion, and to lead with the courage this moment demands. And as the late Congressman John Lewis once asked, words that echo across time and call us to action: if not us, then who? If not now, then when? Let us then resolve with clarity, with conviction, that fear will not define public health, that disinformation will not shape national policy, and the erosion of scientific credibility will not go unanswered. Let this be the moment when integrity prevails, when equity is not just a vision but a practice, when medicine reclaims its voice not only in the patient room, but in the halls of power and the court of public opinion. For it is through our shared purpose, through the enduring partnership between the American College of Physicians and the National Medical Association, that we rise not only as clinicians, but as the conscience of our profession and the guardians of the public good. Thank you.